Dr. Jiang Chuk-kwan, Head of Communicable Disease Branch of the CHP, and also Dr. Lau Ka-hin from the HA. Over to you, Dr. Jiang. Well, for the number of positive cases, there were 10,010 cases. Out of those, 4,747 were confirmed by the HA directly, and then 5,263 were confirmed by the CHP laboratory. For the reported cases yesterday, there were a total of 21,979 cases. Out of the 10,010 cases, 4 were imported cases, others were all local cases. Out of the 5,263 cases, we also did a test on the variants, and 9 were with L452R, and then 5,086 did not carry the L452R. In other words, they were Omicron cases, and then 8 are still being tested. And then for the rest, the virus load was too low, and therefore we were not able to get the result yesterday. And then 420 RCHEs had either residents or workers are being tested positive. So as a result, over 510 workers and also 1,500 residents or inmates were involved. And there were 50 with over 10 workers and inmates being affected. So this is all I'd like to say today. Dr. Lau? Well, thank you. We have 5,550 confirmed and prelim or presumptive cases. They are in the North Lantau Infection Control and also the AWE Community Treatment Center, and they are being hospitalized. And around 1,000 patients are now at the Penny Bay Isolation Center. And then about 200 plus are now at Chin Wan Dorset Hotel. That's the Community Isolation Center. And last night, a total of 51 were in critical condition, and 48 were in serious condition. And as of this morning, 00 hours, during the past 24 hours, 47 patients passed away, and 27 male, 20 female, and age from 9 to 100 years old. And for the 9-year-old boy, we reported to you already yesterday. As for those 47 that passed away yesterday, 27 patients were inmates of RCHEs, and out of the 47, 4 already had 2 jabs, and then 1 only had 1 jab. In other words, for those who have had 1 or more doses, only 5 of them. And then for the rest, that is 42, they have not been vaccinated at all. And then out of the 47 who passed away, 41 were over 65 years old. And then for the remaining 6, they were under 65, and 1 was 9-year-old, and as I already announced yesterday. And then for the rest, the age range were from 48 to 64, and then 2 were age 48. And one of the 48-year-old was an inmate of an RCHE, and he's bedridden for quite a while. And he also had chronic disease, high blood pressure, a stroke patient, and also he had cramps or seizures. And then another 48-year-old who passed away also had chronic diseases. He had terminal renal failure, and he also had cramps and so on. And then another 59-year-old was also bedridden. He also had stroke in the past. And then another 50-year-old had a record of drug abuse. And then another 64-year-old also had chronic illnesses. He had diabetes, and he also was suffering from cancer. And then because of the lagging behind of data, between 21st and the 23rd, another 12 patients passed away, 8 male, 4 females. Age range 45 to 95. Well, since the onset of the fifth wave, 314 patients passed away in public hospitals. Most of them are elderly patients. And over the past 2+ years, a total of 519 patients passed away in public hospitals. And recently, 290 patients have been discharged from public hospitals, and the utilization rate at public hospital of hospital beds has already reached 91%. That's already the upper limit as to the capacity. And about 30+ patients have also been screened or triaged, and they've been found to have been positive. And then about 80 patients have been classified as close contacts. And then up till now, we have about 1,957 staff that have been confirmed to be positive. As regards pediatric isolation facilities, recently some parents have been discussing that for those children that have been confirmed, then what will the arrangements be when they are hospitalized? So let me share with you some of the arrangements at public hospitals. Generally speaking, for those confirmed kids with medical needs, they would have to go to the pediatric isolation facilities for isolation. And then if their carers, for example, their parents, are also confirmed, and if they are able to take care of the patient, that is the young patient, then wherever possible, the hospital will arrange for the patient and the carer to go into the same ward in order to provide convenience for them to take care of their own children. But then if the carer or parents have not been confirmed, then we would not recommend that they would go into the isolation ward together, except for very exceptional circumstances that they have to take care of their children, for example, for breastfeeding moms. Then the hospital management would look at the circumstances of the individual cases where exceptional consideration will be made. And I'm sure you would understand it, because for the isolation wards in public hospitals, they are very crowded already, and therefore there is not really much space available for the parents to stay behind with their kids, and wherever possible, we will try to admit more children as far as possible.
If the carers are not given the opportunity to accompany their children, the hospital will allow visit through video calls. At a designated time, reports are made to the parents on the progress of the children so that the parents can rest assured. Let me give you another pleading. The majority of the A&E department of public hospitals are overloaded with large number of calls. QEH and Kwangwa are very crowded. The majority of the patients are elderly people, or they are in poor health conditions. The hospitals have to focus all their efforts to deal with serious cases suffering from COVID-19 and other patients who are in bad condition. The fire services in the past few days have received calls for ambulances, among which more than 30% of the calls were from people asymptomatic or having mild symptoms. The overall serious delay actually reached 486 cases. The situation was very serious. The HA asked the public that those who are asymptomatic or have mild symptoms should not visit the A&E departments, and they should not call the ambulance, because that will impede the response to the calls of those who are seriously ill. For asymptomatic patients or mild patients, because of limited capacity, they will not be hospitalized. And we have designated clinics to provide consultation to patients who have mild symptoms. If you have any medical inquiry, please also call our support line, 1-836-115. As for those tests positive by RAT, they should receive a further PCR test and wait for the result. And those who have called the A&E department, they also want to have the COVID test. I urge members of the public to receive tests through other channels, such as at the community testing centers, or provide deep throat saliva tests. And I also want to mention the donation by the Li Ka-shing Foundation. We'd like to thank the foundation for donating generously $50 million to DHA, so that non-COVID patients who need surgery can be referred to private hospitals. The first phase will be for the cardiovascular patients. The hospitals involved are Sanatorium, Hong Kong, Gleneagle, CUHK Hospital, St. Teresa Hospital, and Precious Blood Hospital. About 200 cardiovascular patients will be benefited by the scheme. Patients will be referred to private hospitals for treatment in the future. We plan to include designated types of cancer patients. Before you ask questions, please introduce yourself and your organization. I'm from RTHK. I have two questions for Dr. Chuang. We have seen recently that buildings subject to restricted declarations were mainly public housing estates. Why is it so? Is it a matter of design fault, or is it a matter of management problem? And the public housing estates have so many outbreaks. Will you give suggestions to the housing authority or housing department to prevent this happening in the future? Dr. Lau just recently said that people who have tested positive by RAT will have to wait for test results from the community testing centers or by PCR tests. Now they take RAT tests. This is not official. Are they regarded as preliminary positive? Now when they go to work, when they go out, what suggestions do you give them? And for government departments, the staff of government departments, what would you suggest if they have RAT positive? Tin Shui Wai Hospital will admit confirmed positive cases tomorrow. Now, with this measure, to what extent can that help to alleviate the situation? Now, during the not so serious phases, we have seen lateral and horizontal and vertical transmission in private buildings, and in particular in public housing buildings. For horizontal spreading or transmission, usually it's people going out in the lift lobby or in the corridor, they spread the virus. And so vertical transmission is usually because of the pipes, or they switch on the upper floor and lower floors, they switch on the ventilation fans, and also turbulence at the rooftop and things like that. EPD experts and housing and building experts have inspected those buildings, and they have made suggestions to follow up. As for RAT, now if people have been tested positive by RAT, they should ask their friends or relatives to get some bottles to take samples for deep saliva testing, and then put them in the drop boxes. This is a message for this can be a confirmation for the tests. RAT cannot be regarded as confirmed cases. PCR tests can be, and we can also have contractors to distribute the bottles, and they can make calls. As for Tin Shui Wai, starting from midnight, it will admit COVID patients, and we have about 300 beds. We want to concentrate all the patients in one place to care for them. That in terms of use of space, use of manpower, and infection control will be more efficient. And some patients, therefore, who are non-COVID patients will be transferred to hospitals in the same cluster, say, for example, in Tuen Mun or Pok. And there may also be cross-cluster deployment, and we'll make the arrangements accordingly. During the same period, the A&E department will continue to provide service, and they will handle emergency cases brought in by ambulances. If patients call on the A&E department on their own, you have to note that the A&E department is overloaded, and people who have mild symptoms should not call on the A&E department, nor should they call ambulances. If you call ambulance to bring you to an A department, you will not be given earlier treatment. You will only delay the process. If you have mild symptoms, please make an appointment with a designated clinic. We have 9 of them. You can make calls and make medical appointments, and then the doctors will give you medication and instructions. If the doctors find that you have the need to be hospitalized, you will be referred to the hospital. But if you only have mild symptoms, don't visit the A&E department of the hospitals. Say a RAT positive patient calls on the A&E department, that will only cause burden on the A&E department, and other people will have to wait longer.
That might also affect their treatment and even their lives. And given the fact that, there are many people at the A&E department, so if you are a presumptive case, then you might also be infecting others. We don't want to see such infection within the hospital setting. Given the very stringent situation that we are now all in, and therefore we will have to work together. So we will have to do our own part so that we would be able to make things better, and then we can all ride out of this. But then for the preliminary positive cases, there might be a transitional period. So how would the government departments and also other departments be dealing with such staff? Well, we are actually monitoring the situation closely and will be announcing shortly when we come to a decision. Yes, I'm from Now TV. I have several questions. First, on the HA. Well, actually, the chairman also gave an interview, and he said that he'd like to see a large team from the mainland to be sent over to help. So given the tight manpower situation at the HA, so how serious is it? So you also talk about the number of staff that have been confirmed, and how many have been isolated, and which hospital is experiencing the most dire situation right now. And also for the mainland, well, there would also be a bubble isolation treatment for some of the staff within that circle. So to what extent are you going to do the same? And will you be consulting the staff beforehand? And also, I'd like to know about the Miramar shopping center. There was also an outbreak. Yes, you said that there was isolated cases, but then does it mean that you're not going to announce further with regard to public places where there has been or where there have been outbreaks? Or else, can you tell us how many staff of the shopping center have been infected? Would that be notified to the CHP? And also, I'd like to know more about the CHP guidelines for eateries and also shopping centers. Is it that whenever there is a confirmed case, they will have to close down and so on, or else what are the consequences? And also for the prelim confirmed cases, well, there are some 10,000 positive cases today. So with the rapid rise, has it got to do with the number of tests that have been given? And are there any cases that have been backlog of previous days and so on? And also just now, you also talk about some young kids being hospitalized. So can you announce or tell us how many children are now being hospitalized? And finally, you said that at the next stage, private hospitals would also be admitting and doing some cancer operations. So what kind of operations are those? Well, let me first turn to the recommendations. Well, we suggest that for those who have been to premises and restaurants and so on, it's just a recommendation. It is not legally binding. But then for the restaurants and so on, if there has been any outbreak, then they should close down for major sanitization, and they should also make arrangements for their staff to undergo testing wherever possible. So that's the way to effectively control the spread of the epidemic. And of course, we understand that there are many cases in the community and that not all cases would be happening in the premises. But then if we are able to do something about it, that would also help stop the spread. For example, the eateries or the shopping centers can also help stop the spread. And therefore, we hope the management would also take note of that. With regard to the cases that were reported yesterday, yes, obviously, there are some cases. For example, for the HA, there were some 4,700. And once they have been tested positive, we would directly confirm those as confirmed cases. And therefore, the number would be directly submitted by the HA. And what we've been doing would be cases referred to us by private laboratories. And for the tests that they have conducted, of course, there would be delays in the reporting. And there was also some backlog in our laboratories. So we might be referring to cases that have been confirmed a day or a couple of days before. For the 10,000 plus cases, they have been tested positive. And then I think the best way to reflect the trend is that if you look at the reported cases that we received yesterday, so those were the cases from the private laboratories and also our own laboratories or the HA laboratories. So altogether, they group together all the cases once they have been tested positive. And of course, if they haven't finished if they haven't got the results, then of course nothing can be done about it. Within 24 hours, we received the figures. It was 21,900. So that was a rapid rise. And of course, yesterday that was 17,000. So we're talking about exponential rise. So we are talking about an interval of 24 hours. Yes, Dr. Lau? Yes, as we all know, the situation is really very serious. We have about 2,000 colleagues up till now. So about 2,000 colleagues have been infected. And for close contacts, the number should be even higher, but then I don't have the figures with me now. And I would suspect that several thousand colleagues might have simultaneously been not able to report for duty for one reason or another. I don't have the figures with me, but then I suspect that that would be the case. And out of those 2,000 colleagues, since the start of the fifth wave, some have already come back for work, and some are still undergoing treatment or rehabilitation. And of course, I do want them to be back for duty as soon as possible. And given the current workload, that has already far exceeded our capacity. And many colleagues have been working day and night without rest to take care of their patients, including COVID patients, and also for those who have to receive treatment at the hospitals. And for those that have been hospitalized, in fact, the number is very great, and therefore manpower has been very, very tight. And as I said, we've been liaising with private hospitals as to whether or not we can transfer the patients to the private hospitals for treatment. And thanks to the Li Ka-shing Foundation's donation, as I said, about 200 cardiovascular patients would be able to receive treatment at private hospitals. And then for cancer patients, we are still discussing with them as to who would be suitable for such transfer and how we are going to transfer them, and at which hospital will they be receiving treatment and so on. So arrangements are being made. We have been hoping that for our private sector counterparts, in fact, about half of our colleagues are working in the private sector. We hope that our private sector counterparts, wherever possible, can also take part to become part-timers, because we do have different schemes available so that they can also help with our work. As to the arrangement for young patients, all along around 400, 500 minor patients are staying with our hospitals for COVID treatment. So that has far exceeded what we had during the first to the fourth wave. And previously, we did have some arrangements in place. For example, for patients whose parents have not been infected, they could also go in to take care of their children. But then, given the fact that we are having a rising number of young patients, and we also have to make arrangements for them to go into negative pressure rooms and so on. And therefore, if their parents are going to accompany them, then that would also reduce the capacity of our hospitals or isolation rooms that can take in other patients. Just imagine if you were a parent and if your child is infected waiting for hospitalization, then you would, of course, hope that he can go in as soon as possible. But what if another parent is taking up the space and therefore your kid cannot be admitted? What would you feel? So therefore, we hope that you would also put yourselves into other people's shoes. So you will have to do your part. Other than the fact that you would hope that your kid can be admitted as soon as possible, we also hope that other children can also be admitted as soon as possible. Sorry, speaker's not coming through his mic. He's not using a mic. How are you going to confirm whether or not he's confirmed and whether or not you're going to issue guidelines on this? What about the bottles? Next question, English question. Over there, the lady.
CMP, are health authorities aware of protests from Penny's Bay residents who are unsatisfied with the delay in their discharge? Why was there such a delay, and has the government adopted more technology to help manage the facility better? I'd also like to follow up on the 9-year-old boy who died yesterday morning. Does HA have a bit more of an idea of how he got infected, and do we know if the death is due to COVID or other reasons? And is the DH lab currently operating at maximum capacity? Does the CHP know how many tests are currently backlogged? Will the FireEye lab help confirm cases, or will health authorities consider accepting results from private labs without further confirmation to speed up results? And I'd just like to ask how many infections there are currently at the Seongseo slaughterhouse and how long it will need to close for. Thank you.
Maybe I'll answer about the slaughterhouse. I understand from FHD, the Food and Environmental Hygiene Department, that there have been around 190 positive cases, either by PCR or by RIT. So they are closing it for disinfection and stop for a while. Yeah.
For the Penny Bay management, actually, the hospital authority is providing the medical service in the Penny Bay. We know that the patients was given a hotline that the patient can call and ask about the medical issues. We know that the hotline was quite busy, so hospital authority has tried to upgrade the hotline as well as increase the manpower to manage the in-call. If the patient has any medical need, the patient can use the QR code, which was given when the patient was admitted to the Penny Bay, and when the patient used that code, the patient can enter the information to a page so that the medical staff will know about it. For the 9-year-old boy, because the boy was referred to the coroner, and the boy died very shortly, and we still don't know the reason of. Although that boy has chronic history of some genetic disease, and we need to wait for the investigation of the coroner in order to know the exact reasons of death.
Next question.
Lab is at maximum capacity, and how many tests are currently backlogged?
I don't have the exact figure, but I understand that many of the specimens sent to our laboratory, a significant proportion of the specimens sent to our laboratory cannot be confirmed within 24 or 48 hours. So I think there's a backlog there.
下題，問多條英文問題，前邊。
We may have one more English question, the one in the front.
Thank you, doctors. I'm from Bloomberg News. Following the cases of the child COVID cases, other than the 9-year-old that just passed, there were reports of also a 4-year-old and a 2-year-old, 2 children who are possibly in critical or serious conditions. Can you please give more information about these cases? And also, out of the 51 critical and 48 serious cases reported today, are there any other children in these groups? And my second question is about the corrections facility. There has been reports of over 330 preliminary positive and confirmed cases in those in detention and jail facilities. Can you provide any more information on how those cases are being managed? Thank you.
So far, I just got the information about a 5-year-old girl who was in the critical condition. That girl present with fever for a few days before the admission, and also vomiting and chest discomfort. And then the patient developed some heart rhythm problem, including the fast heart rate. And then the patient was treated by medications and was then admitted to the children's hospital for further management. Yeah, that's what I know.
I don't have the exact figures of the correctional institutions, the number of confirmed cases, but I understand that there indeed quite a number of cases among those institutions, and it's according to our existing advice, they will isolate them and together with they would separate those close contacts with other inmates and offer testing for those staff and also the inmates.
下一題，
Next question. The lady on the third row. I'm from Cable. The number of confirmed cases is more than 10,000. Is the situation out of control? Will you continue try to hold up everybody? How many people are waiting for PCR results? How many days do they have to wait? Concerning the one in Cheung Sha Wan, which has been under restriction order, and why it has been released, how many cases have been identified in comparison with isolation at home, how effective it is. And concerning the RTHK TV TAR and also other media institutions, no information has been released. Some said that in order not to affect public image, they do not disclose the number of infections. Is it the case? And how many staff members are tested positive or preliminary positive? Will the administration adopt emergency law to introduce 5,000 carers for RCHEs? Do the RCHEs not have adequate manpower, and do you need to import carers from the mainland? The 109 cases in the Shangshui abattoir, is it an accumulated number, or is it a new recent number? Well, as far as I know, in the past few days, concerning buildings subject to restriction declaration. They have new cases, and we deal with the RAT first because they were newly discovered and they have high risk of spreading, and therefore they are sent to isolation facilities earlier. This will help to reduce spreading in the buildings. As for individual companies, I do not want to comment on their situation, and I don't have the details concerning the number of carers. You may ask for information from other government departments. As far as I know, I don't have information on the waiting time. Just now, Dr. Chuang said that there are 10,000 reported cases. Many confirmed positive cases are waiting for our isolation facilities. Because of this, we will have to do some screening. Those who have the need to be hospitalized or community treatment facilities will be given priority. Say, for example, the elderly people, the chronically ill, those who have poor immunity, small children, pregnant women, and they will be given priority. They will be take care of in hospitals or community facilities.
And then where isolation facilities are available, we will arrange for them to be admitted. As you know, there are more isolation facilities being built. And for those who are waiting at home, we hope that they would also implement some infection control measures. So we hope that you understand the situation. Next, I'd like to supplement. That is the cumulative figure as at the 23rd of February. That's about the Shangshui slaughterhouse. Sorry, speaker is not coming through. She's not speaking to the mic. Well, I don't know what you meant by out of control, but of course, the case number is rising. Next, the one in pink. Well, I'm from Dot News. Well, there was a report that one person waited for 9 days without the test results. So is that far from satisfactory? And also about the sample or specimen taking capacity, what's the average? And also on average, how long do they have to wait before they can get the result? And also after the mainland team has arrived in Hong Kong, to what extent will they be able to help? And also for the specific capacity that we have right now, so can you tell us exactly how many you can test? There are also medical staff that have been tested positive. So will you be renting dedicated hotels for them so that there would be bubble isolation facilities so that they would not be going back into the community to infect others? They will not be bringing the disease to their homes. And also, how many private hospitals or private doctors that have enrolled to help with the fight? And also, how many cases have been processed? So if possible, can you tell us? With regard to testing, I don't have the actual figures, but then as far as I'm aware, some 200,000 would be involved. So we would be testing about 200,000 every day. I don't know exactly how many or what's the exact rise. And then of course you refer to people waiting for quite a while before getting the result, and of course that is not satisfactory. And of course after they have done the test, the private laboratories would be uploading the results as to how many people have been tested, and that would also be uploaded onto the government's webpage. We will then take follow-up action. That's the arrangement. But then there are also some constraints as to the number of tests that can be carried out. I hope that there can be improvements shortly. Yes, we understand that currently the manpower situation is very tight. Well, with the private hospitals' help, that's a very important part of it. As I said, some private hospitals, with the help from the Li Ka-shing Foundation, they would be offering places for the cardiovascular patients. Should be five. 5 private hospitals will join. And then we are liaising with other private hospitals, so more will be coming on stream. They'll be joining, providing different services, including treatment for cancer patients. I don't have information about how many private doctors have enrolled into our part-timer program. But then since the last appeal, many in the private sector have already enrolled into our program. And I'd like to take the opportunity to make this appeal again. That is, if private practicing doctors are able to join our program to work as part-timers, then in fact, the WhatsApp number is 9788-8960. And then all they need to do is they just need to upload their practicing certificate in WhatsApp, and then we will have people following up on that. Once again, I'd like to call upon our counterparts in the private sector so that they can lend us a helping hand. Next, the one in gray. I'm from TVB. I'd just like to know, given the figures in recent days, you're actually talking about an exponential rise every day. So is it so does it mean that the tightening social distancing measures are not working? And also, because of the inability to do more testing, that's the reason why we have seen this growth? That's the first question. Second, starting from middle of next month, we are going to have the universal mandatory testing, but then there are 2 weeks to go before the middle of next month. So what measures will be put in place to suppress the further spread of this disease? Well, before we carry out the mandatory testing universally, what else can be done? And also, Dr. Lau, you said that for children's beds, we have about 400 to 500. So is that already the upper limit? Because you can see that there are some backlogs in the community. For example, with some presumptive cases, they are still not able to be admitted. So are you able to increase the number? So have you identified places in order to accommodate these young patients? Well, I think the situation is that the number is still on the rise. With regard to whether or not we are able to ease the situation, that would include several aspects. Isolation facilities would be one thing. We have a severe shortage of that, and also social distancing. But then the biggest problem is whether or not people in a community are going to cooperate. Are they going to stay home? Can companies arrange for their staff to work from home? When you go out to the streets, there are still quite a few people on the streets. And of course, with the latest measures that has come down already, still is not that there are only very few people in the streets. And therefore, all these will play a part. Well, we have 400 to 500 children with COVID. They are staying in HA hospitals for treatment. That's indeed more than we have been able to accept. So we have been trying our best to make use of our space in order to admit these young patients. Some of the children are still waiting in the community for hospital beds. So once again, I'd like to apologize for that. So that's not satisfactory. Yet we have been doing our level best, and we have been very expeditious. Whoever can be discharged will be discharged, and we are also identifying new facilities. We are also thinking about, let's say, for the infection control center, for example, AWE, can we have some family wards to admit young patients? Well, it's not just about minors that have been infected. In fact, in most cases, since they don't have to go to schools, and therefore, most likely they would be infected by their adult family members. So once they have to be admitted, can the entire family go into the same ward? So if children are infected, then you will have to make sure that you will take their temperature on a regular basis to monitor their condition closely. I think many pediatricians have been telling you as to what needs to be done about these minor patients. That is, you will have to be alert about the red flags, so to speak, so that once they develop such symptoms, you will have to take them to the hospitals as soon as possible. For example, persistent high fever and also cramps, and if they appear to be very dizzy and so on, well, if they just appear to be very dull and if they have a bad appetite and so on. So I'm not a pediatrician, but then you can refer to the guidelines offered by some pediatricians. So while we are fighting the pandemic together, we will have to make sure that we are armed with the right knowledge so that we would have fewer anxieties. Next, the lady there at the back with glasses. Yes, I'm from Mingpao Daily. I'd like to know, well, earlier on, you changed the discharge criteria so that once you have 7 days in a row of antigen negative, then you can be discharged. So to what extent have patients been able to meet the criteria and been discharged? And how many people have been discharged and go back to the community? And gone back to the community. So how many well, what about their stay? How much shorter are they staying in the hospital right now? And for people who have just mild symptoms and they are occupying hospital beds, and yet for those with acute symptoms, they are waiting at the A&E department. And then some doctors are suggesting that so long as they have been tested negative at the hospital, they should be discharged. So will you consider that? Next, as Dr. Lau just said, for the rapid tests, if they have been tested positive, then they will have to give the deep throat specimen. But then according to some, well, it's very hard to get the specimen bottle right now. So do you have any suggestions for them? So that for those who have been tested antigen positive, where can they get the bottles? What kind of support can they get? And you also said that for those with no or mild symptoms, they should not be hospitalized. Are you referring to public hospitals, or do you mean that they should not even go into the community isolation hospitals or facilities? And what about the isolation hotels at Penny Base and other isolation facilities? In fact, the numbers are quite large, but then the utilization rates right now is not that high. So can you explain why it's so low? Is it because of the operation, or is it that the patients are not suitable for admission to those facilities? And also, what about the 4-year-old at the Yan Chai Hospital? Can you tell us more about his case? Well, right now, I don't have the figures with regard to how many patients have been discharged under the new criteria. But then I understand that their hospital stay has been shortened when compared to previously. So they will have to undergo a rapid antigen test, and if it's negative and there are no high-risk high-risk family members at home, then they can be discharged. And then after another 7 days, they can, if they are tested negative again, then they can go out and they can go back to work. Well, in fact, on a daily basis, for different wards, in particular for the medicine ward, our doctors would monitor the condition of individual patients in the medicine ward, and if they are suitable for discharge. In fact, we'd very much like to do so. We are more earnest than you do in discharging them. And therefore, there is no question of a patient who have been kept in the hospital despite the fact that they do not have any symptoms and so on. So in fact, they might not understand the situation. They might need to be hospitalized, but then there might be symptoms that you might not be aware of. And therefore, you will have to get more details about the case before you know what's happening on the ground.
Well, to make sure that every staff member, or rather we are sure that every staff member, including those in the front line, are doing their best to make sure that the patients are properly cared for. Concerning those waiting for results or who are not able to get the testing bottles, we are aware of the situation. We know that that is far from satisfactory. We have to consider the priorities for testing, and we will disclose information in due course. Sorry, speaker is not coming through. I only have a number. I've announced that in Penny Bay, about 1,000 persons are isolated there. In Dorset Hotel, 420. From time to time, the coordination center staff members are trying their best to inform the patients and also the fire services to bring patients to different isolation facilities. As you know, because of transport factors, because of other factors, the speed is affected. But we are doing our best. 2 more questions. The one in gray at the back. The 2 doctors. The doctors, good afternoon. I'm from Phoenix. With regard to number 2 AWE, what is the usage rate? And will other houses of AWD be open to admit patients for isolation? Will there be cabins giving priority to children and their family members if you have more facilities? As for number 2 AWE, it is operated by the SWD. In our public hospitals, elderly people in the public hospitals or elderly people in RCHE will be sent to AWE number 2. The SWD will get the carers to care for these patients. HA will send doctors to provide consultation and continue to treat the patients there. As for number 1 AWE, we are going to open that very soon. The design of number 1 AWE will be for younger patients. In the long term, we have to make arrangements to fit in with the overall arrangements made by the government. The government is building different isolation facilities for different types of patients, different types of COVID patients for isolation treatment. The last question, the lady over there. Good afternoon, I'm from Economic Times. For the 4-year-old boy in a coma yesterday, how is his situation? And for the 5-year-old girl, when was she admitted? What was the CT value? Did she have any chronic illness? Concerning the emergency law, how many mainland healthcare workers will be brought into Hong Kong? They don't need any registration. So have you considered the apportionment of responsibilities? As for the private hospitals, some of them require the hospital, the public sector hospital, DHA, to confirm that they will be allowed to discharge the patients within 14 days. Is it true? Will you continue tracking? Is there any use to conduct tracking anymore? Let me answer the questions first. We have more than 10,000 cases. We focus our efforts on informing the DHA that these are the patients who need isolation, who need treatment. We also require their family members to be tested. Sorry, speaker is not coming through. As for Leave Home Safe, people have to continue to use it, but we can focus our efforts on the close contacts first. As for the 4-year-old boy in the hospital, I said that he had convulsions, he had a fever, he visited the A&E department, he had RAT positive. We took another sample and the outcome was also positive. He was then admitted. We know that he's positive, so he is transferred to PMQ. And his situation has stabilized, and his fever, he doesn't have any fever now. As for the 5-year-old girl, on the 24th of February, she was admitted. Should be by QM, Queen Mary. Before admission, she had chest pain, vomit, and fever. Her family members had RAT positive. parents, worker, all tested positive, and some symptoms. The mother and sister had positive symptoms. We tested the girl; she was positive, and there was the problem of fast heartbeat. And then a pediatric cardiologist was called, and she was transferred to the pediatric hospital because we have the pediatric cardiologist to take care of the patients. Sorry, I don't have information. Sorry, speaker's not coming through. She doesn't have any, she's not using any microphone. No, the reported cases is updated 24 hours. As for the 17,000 reported cases, some of them have not yet been confirmed. Well, we are working on the samples, and we may not be able to get the results within 24 hours. Well, let me see. As far as I know, there are many samples of the reported cases have not been sent to the labs of the CHP. We have some samples which have not been worked on because they don't send the samples to us immediately, maybe a few thousand of them.
But then we have on hand about 10,000, 20,000. So some specimens have yet to reach us. So will you consider amending the relevant criteria? We don't have any intention to change that for the time being. Thank you.
暫時我冇住。